Guys, there is an outbreak of a deadly disease plaguing our states in Nigeria. A deadly disease, a deadly virus that is plaguing our states. A deadly viral disease spreading like wildfire, rampaging our states in Nigeria, and it's of public health importance. So you don't have to treat this video as one of those common video. As your public health nurse, I am here to give you this vital information, first-hand information to stay safe wherever you are, and the precautions that you need to take, the safety measures you need to put in place to keep you alert, to keep you safe, and the vital health information to help you and your loved ones to stay safe. This disease is an acute viral hemorrhagic disease. As it stands, we have recorded different cases of death in our country, Nigeria. So you don't need to live your life casually in order not to be a casualty in the hospital. So this information is to enlighten you because we have recorded death case in Plateau State in a hospital, and a medical doctor, a senior registrar by name Dr. Salome Oboyi, became a victim after carrying out emergency C-section for a patient who is infected with this virus. So this virus is spreading like wildfire. It is endemic in our country, Nigeria. Just when you think it is gone, it will resurface again. Just yesterday, 12th of February 2026, I got a reminder from Facebook of a post I made on the 12th of February 2025 of the same illness. So just when you think that this disease is no longer there, it will resurface from nowhere. So it's endemic. It's something that you need to know what to do in order to stay safe. So this video, endeavor to share this video to enlighten others. Lassa fever is plaguing, is rampaging in our country, in our society, in our environment, in our different communities. So you need to stay safe wherever you are. Lassa fever is an acute viral hemorrhagic disease caused by Lassa virus. And this Lassa virus is spread or carried by the rats from the multi-magnates family, mastomys rats. And this rat is a special kind of rat. It's different from other kind of rats. How do you identify this rat? This rat comes with multiple breasts or nipples. That is how to differentiate it. It comes with multiple breasts or multiple nipples. So you have to stay alert, stay informed, be health conscious. Lassa fever is real here in our country, Nigeria. So you have to take precautions, take preventive measures in order to stay safe wherever you are. Or if you are traveling to different states in Nigeria where there is a recorded case of this viral disease, you need to know what to do to stay safe. And if I were you, these states with this present record of Lassa fever, if I may advise, stay away from these states with recorded cases of Lassa fever. So this Lassa fever is found in a rat known as mastomys rats. That is the name of the rat that spread this deadly virus. Like I said, it comes with multiple breasts or multiple nipples. All right, so you can see it on the picture there. There are two modes of transmission of this viral disease. The first mode of transmission is through animal to human transmission. That is to say, if for people that expose their food to the sun, drying on the sun or outside, and you expose your food, this rat coming in contact, urinating on it or defecate on this food item, and you happen to eat this food contaminated by this virus, or you touch the urine from this animal, you get infected. And to those that eat mouse, you should be very, very careful. So humans get infected when you expose your food or food items to this Lassa virus. When this rat comes in contact with your food items, defecate on it, urinate on it, and you eat this food with this virus, you get infected. For those that eat rats, you get infected with Lassa virus if you eat the one that is being contaminated with this virus. Okay, And then the second mode of transmission is human to human transmission. Human to human transmission means when an individual comes in contact with one infected with the Lassa virus through the blood, urine, feces, vomit of an infected person or body fluid of an infected person, you get infected. Another way of contacting this through human to human is through contaminated instruments, especially for healthcare personnel. Another way human to human can contact it is through poor infection control system in the hospital setting or within your vicinity, poor hygiene, poor sanitary hygiene, poor environmental hygiene. You can easily contact it. These are the way you can contact it human to human. Coming in contact with contaminated instruments, contaminated equipment, doors, handles of doors, grills, you can easily contact it if an infected person touches those areas. Now, what are the signs and symptoms of this viral disease? Number one signs and symptoms of this viral disease is fever, headache, body weakness, sore throat, nausea and vomiting, diarrhea, chest pain, body aches, difficulty in breathing in severe cases, then bleeding from the ear, bleeding from the nose, bleeding from the mouth in severe cases. So these are the signs and symptoms to watch out for Lassa fever. Then what are the preventions of this viral disease? The first prevention is good personal and environmental hygiene. Keep your surrounding clean. Stay clean. Okay? Secondly, endeavor to keep your homes, your surroundings free from rodents, rats, mouse. Keep them free. Maintain environmental hygiene. Keep rats away from your environment. And then the third thing you should do, endeavor to store your food in an airtight, rat-proof container. Yes, don't spread your food outside on the road or on the roof to dry your food. You can easily contact them when those rats get in contact with them. So store your food in an airtight container to prevent the invasion or the penetration of rodents or this mastomys rat, to keep you free from Lassa fever. The next prevention is endeavor to dispose your garbage properly. Proper sewage disposal is very, very important. Bag your waste, bag your trash properly and dispose them properly and regularly instead of keeping them to pile up. When you keep them to pile up, it attracts those mouse to your environment. And then the next preventive measure is, if you're the type that eat rats, stop eating rat, stop eating mouse. If you're the one that use mouse as pets, endeavor to stop using rats as pets. They are not friendly, they are deadly, they carry deadly virus. The next preventive measure is to practice good hand washing hygiene. Endeavor to wash your hand properly anytime you go out. If you visit someone, practice good hand washing hygiene. It will save you a lot from contacting some infection. It is very, very effective. So practice good hand washing hygiene to stay safe. The next point is to avoid contact with the body fluid, blood, vomit of a sick person, because you actually don't know what is wrong with the person. So stay away from any body fluid, any blood or blood products of a sick person. Very importantly, ensure you see holes on your wall, holes in your houses. Seal them. Use cement or anything to cover, to block entrance. Any holes that you know that rodent can easily penetrate or pass through. And then the most important thing you should do here is you should endeavor to report any case of sick persons with constant fever, headache, weakness, diarrhea, nausea and vomiting that you know has lingered for some time. You have treated malaria and it still lingers. Please endeavor to report such case to the health facility. Isolate the person while you report to the nearest health facility for your own safety. Okay? Then use protective measures like hand glove, face mask if you must touch one that is infected with this disease. If you must get in contact with one that is sick, endeavor to make use of hand glove and face mask. And also practice social distancing until proven otherwise that the person is not infected with Lassa fever. Okay, all right, now you've known what Lassa fever is all about, the causative agent, the signs and symptoms, and the mode of prevention. I encourage you, share this video. What are you waiting for if you have not shared this video? What are you waiting for if you haven't shared this video? Endeavor to share this video to enlighten others. Don't be selfish with knowledge. It is real. Lassa fever is real in our society today. So share this video, like, comment, subscribe to my channel. Share this video to keep others informed. To be forewarned is to be forearmed. Okay? I am your public health nurse. So I choose to give you first-hand information to keep you safe and to keep you aware of the happenings within our society today. All right. So my advice for you today is stay safe, stay informed, and take care of your health. Don't say you are not aware. So take good care of your health. Your health matters. So your health matters to me as your own person. So take care of your health. Oh, so remember, prevention is better than cure. So stay safe. See you again in my next video. Bye.